ensures your baby receives the best possible start. Our state-of-the-art neonatal intensive care unit is equipped to handle even the most delicate case, ensuring the smallest patients get the strongest support. As your child grows, regular health checkups are crucial. Our pediatricians provide comprehensive assessment, development screening, and immunization, supporting health growth every step of the way. Health is more than just prevention. Our team of specialist pediatricians provide a range of acute and chronic conditions from asthma and diabetes to rare genetic disorders with advanced diagnostic and personalized treatment plans. We also offer comprehensive rehabilitation services, including physical, occupational, and speech therapy to help children reach their full potential, overcoming challenges with strength and resilience. Our hospital is open 24 hours a week. Visit us today for specialist pediatric care.
A very good morning to you, dear viewer. Welcome to our Health Corner show right here on Capuchin TV with me, Maureen Kimani, where we discuss matters concerning your health. And today we have a very interesting conversation. As you can see down on your screen, that is daycare cases and surgical care. And we're going to be shedding more light about what is it all about, its benefit, and how it's improving healthcare services and in our country. And joining me right now, we have Dr. Kim from St. Francis Community Health, St. Francis Community Hospital, Kasarani. Yes, that is right. And he's going to be shedding more light about this topic and conversation we have here today. And in case you'd love to be part of this conversation, please do reach out to us on 0717 424 866, or you can use the SMS number that is 21760, and we shall be getting back to you as soon as we get your feedback. But right now, allow me to introduce to you my guest here with me. A very good morning to you, Dr. Kim.
Good morning, Maureen.
Good to see you.
Good to see you as well, and thank you for having me, and welcome to our viewers this morning. Yes.
Well, tell us more about yourself, because it's the very first time we are having you here at Capuchin TV. Please introduce yourself to the viewers.
Okay, as they've heard, my name is Dr. Kim Mangoa. I'm a consultant general surgeon and the head of the Department of Surgery at St. Francis Community Hospital, that's in Kasarani. I've been head of the department for about 1.5 years now. Wow. We've been growing stride by stride, and the topic for today is actually one of our new ventures that I'm really happy to talk about and introduce to our viewers and inform them more about what's available out there for them. Yes.
All right. Thank you very much for making time. And of course, I can't wait to hear what you have to share to our viewers. And of course, as the viewers learn, I'll also be learning too. And thank you very much. And you're most welcome here at Capuchin TV.
Thank you.
Well, let's kick it off. When you talk about daycare surgeries, I'm sure not so many people have come close to these terms. Maybe they don't know what is it all about. Could you elaborate further about it?
Okay, so it's fairly new in Kenya space, but it goes by many terms internationally. So it's either daycare or ambulatory surgical care. What this essentially means is care within the hospital that allows you to be admitted and discharged within 12 hours. So essentially you come in the morning, have your care done during the day, and by evening you're back home within your own four walls. And that essentially is the premise of it. So it's quick in, quick out for the patient.
Okay.
Yeah.
And how does it differ from the inpatient surgeries?
So these tend to be much more straightforward cases, quite routine cases that can be easily scheduled. So what we call cold cases. So usually not your major emergencies like trauma, someone coming from an accident and so on, but something where you schedule probably a week in advance. The patient is aware, they know they have to come in early in the morning, have their surgery done and leave. Inpatient surgical care usually involves admission over several days. These are usually major procedures. So even if it's a cold case, so something we plan, it's somewhere where someone will have to be admitted for several days because of recovery requiring to be within the hospital. Yes.
So we could describe it as minor surgeries? Or is it something?
We don't like to think of surgeries as minor, any of them, because I mean, whenever you're operating on someone, it's a major event, especially for the patient. And there are some major surgeries that can still be done within the daycare or ambulatory care scene.
Okay.
Yeah.
And now maybe you can maybe say some of the examples of the types of these daycare surgeries that you maybe operate even at St. Francis Community Hospital?
Yeah, so we offer a wide range of services. As we are a level 5 hospital, we have basically every surgical specialty, and there are also some medical care that can be done within the daycare unit. So I'll speak first of my department. I'm a general surgeon. So we can do a wide range of operations, all the way from hernia repairs. That's when you have an abnormal protrusion, maybe of bowel coming from within the cavity. Usually people find it in the groin. Those can be handled within the day and you go home. Other things like hemorrhoid, commonly known as piles, can also be done within the day and you go home. Minor thyroid procedures, removal of breast lumps and so on, biopsies. Also, all our endoscopy services are done as daycare services. So what people know as OGDs, or an upper GI study, where we take a camera and look through your food pipe, your stomach. Colonoscopy, where we look basically the other way and get to look at your whole colon. All these are screening tests. We're able to do them under the daycare scene. Our plastic surgeons offer a large majority of their services under the daycare. So excision of keloids, large scars, a lot of that they manage to do under the daycare scene. Even skin grafts can be done under the daycare. Patients with burns who require skin grafts can come in the morning, after obviously their burns have healed properly, can come in the morning, have their skin graft done, and actually be home by evening. That is still quite possible. I can also talk about our obstetrics and gynecology colleagues. There are quite a number of procedures they are able to do because they manage to do their procedures under regional anesthesia, meaning the patient doesn't even have to be put completely to sleep. So the recovery is quite fast, within about 6 hours, and the patient manages to go home. I think the other major units would be ophthalmology, cataract procedures, glaucoma procedures, all fit under the daycare scene. I think the only department I'm left with is probably ENT, probably the removal of a few foreign bodies, kids sticking things in their ears, their nose. All those can be sorted, and of course the child goes back home where they'll be much happier.
All right. Okay, and you've just mentioned about the healing process that takes about 6 hours, right?
The recovery from anesthesia.
Yes, recovery, yeah. So what about how long does these daycare surgeries take? Because when we talk about surgeries, you might find even some take even 8 hours, and depends on how the case and the serious problem is. Do you have like a minimum hours that you take to operate on these?
So an 8-hour procedure is a complex procedure, whichever surgical discipline you're talking of. So those very rarely will be considered under our daycare unit. Most of our surgeries last between 1 and 2 hours, if we're talking about the daycare surgeries. So they usually tend to be quite simple procedures and done under what we call regional anesthesia. So either spinal anesthesia, where we just need to numb the lower half of your body, or now what we can do are things like regional blocks. So they can actually numb just the nerves around your wrist, and your whole hand goes numb. A surgeon can operate, and you go home, and the hand will come back to normal in its own time, usually just about 3 hours, 3-4 hours.
Okay,
yeah.
Wow, thank you very much for that information. And let's talk about the benefit of having these daycare surgeries for both the patient and, of course, for the hospital, especially for St. Franciscan Hospital. Okay,
so I would say the major benefit is to the patients especially. We have talked, number one, about cost. Financing healthcare is a big issue for everyone. As you know, it's a big discussion in the country. You're able to reduce about 40% of the cost for a lot of these surgical procedures by actually scheduling them in the daycare unit. The other is convenience for the patient. Of course, recovery is always better in your own home. Hospitals, while they are necessary, are not always the most pleasant area of recovery. In terms of safety, especially in my field, for surgeons, infections are one of our worst enemies. And hospitals, because they are where sick people are, tend to have worse infections. So the sooner you can get a patient home, usually the better, because our homes are actually very clean. And for most of us, that's actually a fact. So the sooner you can get a patient home, the better for them. I would say the other thing is just that peace of mind. for the patient, knowing that on this day, this will happen. I've been assured that this is the cost that it will go, and I will be home by evening. That peace of mind, I think, is also a good thing. And the quality of care in a daycare unit is sometimes a bit better, because the nurse-to-patient ratio in those wards tends to actually be a bit higher sometimes than the inpatient wards, because sometimes the inpatient wards can be flooded. But because the daycare units are scheduled cases, we know the number of patients coming in, we know the number of nurses to allocate there. So the nurse-to-patient ratio is really always well taken care of, well planned for in advance. So it's really good quality of care for the patient.
Okay,
yeah.
All right. And a very interesting thing when you talk about patients doing a follow-up to their, maybe from their doctors and inquiring more about their health issues. When you see about patients when they go to the hospital and once they are given the medication, not so many people tend to finish the medication. Once they start feeling better, you're like, oh, come on, I have to do away with these. What are some of the follow-up, maybe things that patients who have gone and who have maybe gone these daycare surgeries need to know and need to do a follow-up to their doctors?
So for all our patients, if you have a surgery done in our unit, there is always a clinic date that is set for you to see your primary operator, so the surgeon who operated on you. In addition to that, there's usually a follow-up only a few days later. So you may see the surgeon maybe a week later as he monitors your recovery, but within about 3 days for most of our cases, you usually come back to the hospital just for a quick checkup, to check on the wound, usually change the dressing if required, so that we then know that the immediate recovery is also going very well. So that follow-up, we do make sure is done by our clients. Yeah.
Okay, and when I was doing a research on the topic, I saw some people, complaining on how one is kept on the waiting room alone, and I saw some of the doctors, giving our patients advice when you're coming for these daycare surgeries. Make sure you carry your phone, your tablet, so that you can keep yourself company.
Yeah.
Please, could you kindly take us a process on how, when maybe a patient comes to St. Francis Kasarani Hospital, what are some of the process that they do before getting into the final step?
Okay, so essentially when you come, you'll go through the admission process into the daycare unit. So I know I've said you come in and out the same day, but it is a whole unit by itself. So there is a ward and there is a room you're put in, okay? So in that room, obviously, you have a bed, you relax as you wait for your surgery. Yes, you have your phone, you can go on social media and whatever, entertain yourself. Usually, unfortunately, at this time, you can't eat till after your procedure for most of the time. So a lot of the time, we even encourage people to come even with a friend or a relative, someone to keep you company until you go to theater. And once you go to theater, they can come for you later after recovery, because it's usually also advisable to have someone taking you home. Especially if we give you sedation or general anesthesia, we especially don't want you driving home. We especially don't want you just trying to navigate your way home by yourself. Because sometimes, yes, even though we know the anesthesia has wore off, for some people they get a rebound effect where they may feel just slightly more drowsy than usual. So it's always good to have some company at least getting you home. Yeah.
Okay, well, that's very interesting. At least if you have company, better. But if you don't have, you can always carry your phones and you can watch either a movie, listen to the Word of God, music as well, and just to make sure you don't get nervous because so many people get afraid because of surgeries. When you hear the word surgeries, the first thing that comes to your mind, like, will I be able to come out? It doesn't matter whether it's a minor surgery or a major surgery, but the good thing is that the St. Francis Kasarani Hospital has the best doctors. You can be able to get there and interact with them. They will be able to take you through all these processes, and you don't have to get nervous at all.
Yes.
Well, as we continue the conversation, please tell us, what can patients do to minimize the recovery after a daycare surgeries? Maybe the risk afterwards?
So when we're looking at the risk, the most important thing we usually look at is the evaluation before planning for the surgery. So the first thing is always be very open with your doctor. Let him know about any other issues you may have. If you're diabetic, hypertensive, please don't hide that from your doctor. It's important for us to know for planning purposes. Because we also schedule our diabetic patients earlier in the day. And it's simply because if you're not eating and you're taking your medication and your sugars drop too low, we can't have you starving most of the day. So these are very important things. So when patients are honest with us, we are able to give them an honest opinion on how we can schedule their surgeries as best for them. So in addition to that, sometimes there are some tests that we need to do. Research has been done over the last several years that shows actually for a majority of day case surgeries, not many tests are required because it generally will not change the plan of care. So what's really important is the evaluation by the doctor, him actually examining you, knowing your medical history, your surgical history, so that he's aware of what needs to be done on the particular day. Usually for recovery, we give, for most patients, they'll get a couple of days off work. Okay, we usually encourage return to activity as soon as possible. Lying in bed is actually not a good thing for recovery. So we usually make sure that, especially your pain medication, is well optimized, because for most people, that's why they'll stay still. It's actually pain. So usually we need to have a good pain plan post-operatively, and that's why we make sure that the patients have the contacts of their doctors, so that if even on the first day the pain is not fully controlled, that they can get in touch with the doctor, get a prescription to top up their medication. Yeah.
Okay, and when you talk about sleeping for many hours, you know, most of us love living a sedentary lifestyle, but it's always nice to exercise, because most of even maybe the diseases that people get, it's because of their lifestyle, and so you have to watch your diet, you have to work out and all that. It's a good thing that you mentioned, because I feel after so many people come out of their surgeries, most of them, they say, it's my time to relax and heal. I shouldn't do anything.
Actually, what we encourage now is immediate rehabilitative care, and that involves physical therapy. So in some countries, actually, that's a whole subspecialty of medicine. Actually, just that part of recovery post-surgical care, where activity is encouraged and regulated, because it's not one size fits all, obviously. Someone who has had a broken leg obviously cannot recover the same as someone who had an appendix removed or something like that. So there are ways that you need to be able to discuss with your doctor, what activities am I allowed to take part in? What work, relative to the work I do, how soon can I go back to work? How many days should I take off? So those sort of discussions are important between the patient and their doctor. Yeah.
Okay, all right. And let's talk about St. Francis Community Hospital. What are some of the criteria that you use to maybe determine if this patient is well, or maybe can be able to proceed with the day case surgeries? What do you use? Or maybe how do you tell a patient can be able to proceed with that? And in case of an emergency arises, how do you deal with that?
Okay, so for the patients who would qualify, the first thing would be, what does the patient require? So if all you need is a simple hernia repair, and you have no other medical issues or anything like that, yes, obviously you're a very good candidate. But when I examine a patient and I see that there may be a rocky or difficult post-operative period, perhaps that first night could be critical. That is when I may say, okay, fine, I may not be able to offer you this, so please just allow us to keep you overnight, and I'll probably release you in the morning. So it's always usually a matter of what procedure does the patient require, and also how will their recovery be after the surgery. So those two really play in our mind, which is why the tests don't really matter as much to us as our evaluation of the patient. Yeah.
Okay, and what about in such cases where maybe there was a complication, whether during the surgery or even afterwards? What are some of the measures that you put place as a hospital to ensure that in case something like that arises, you can be able to maybe handle it?
Okay, so for us, because we are obviously St. Francis, the hospital is a full hospital. Okay, so as we run our daycare unit, there is another full functioning 24/7 hospital running alongside it. So it is always very possible that, yes, if there is a complication, of course your doctor is always available on phone and to come to address any complications or address any concerns that there may be. There is a full-time nursing staff that is always there and can get in touch with anyone who is required, whether it even be your relatives, your next of kin, if they need to come and give us any further information about you or so on, and maybe even give us permission to hold you overnight. So yes, we are able, even if there is a complication, we have a whole hospital backing us. that we are able just to transit that, fine, this is no longer a day case. It is now on admission. The patient will stay overnight, and we then transfer to the ward, to the inpatient care.
All right. And when we are maybe just choose the topic, we talk about a day case and surgical care, hospital services under SHA, on which it's the biggest conversation in our country today, whether it's working, it's not working in hospital. Please tell us your experience at Kasarani Hospital.
I think my experience, for most medical practitioners, has been a mixed bag. At the beginning, obviously, it was hurdle after hurdle after hurdle. Recently, there have been improvements. I can actually happily say I've treated tens of patients since last year under the SHA program. In the initial time, our approvals were actually taking even sometimes over 2 weeks to come through. Lately, it's actually just been taking a day or two. So that's a marked improvement. The fastest I've gotten is within about 3 hours approval. So patient came today, scheduled the next day for a daycare surgery. And we did the surgery the next day, and he was home by evening. So for him particularly, he was very happy that it worked for him. So while I do say that there are improvements to be made, I think it's up to all of us to push for those improvements, because at some point this must work for all of us. And I think because we are all contributing so much to it, we should get what our worth is for our money. Yes. Yeah, but I think eventually our advocacy, because we are advocating as faith-based organizations in charity, including St. Francis Hospital, that this system works for everyone. And that's what we really want. Yeah.
So it can be able to cover these day case surgeries?
Yes, it is covering them. Yes. Yes, it covers. Yeah.
Okay, all right. Thank you very much, Dr. Kim, for shedding more light about these day case surgeries and surgical care here on our Health Corner show. And I'm sure you have lots to talk about, maybe even afterwards, on how maybe the patients can also reach out to the hospitals, and maybe in case they want to transfer or inquire about a certain being, not only for these maybe specific topic that we're talking about, you can be able to maybe give out to the viewers who are watching us, and of course, in case there is a question that arises, you may be able to, of course, get back to them.
Yes.
But first, we're gonna take a very short break. I can see our time is almost up, and we're gonna take a very short break, but we will be continuing with the conversation right here on our Health Corner show. And as Capuchin TV, we say your health is your wealth, and that's why we bring you this conversation concerning your health matters to ensure that you keep fit, you stay healthy, so that you can be able to also support and follow Capuchin TV. Stay tuned for that. We take a very short break, but after that we shall continue with our conversation today, that is day case and surgical care. Stay tuned for that.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Congratulations! I'm Dr. Clovis Ibomana Akili, the resident gynecologist at St. Francis Community Hospital. I say welcome all pregnant mothers, where we are journeying with you from the conception all the way to the delivery of the baby. And even after the delivery, we give you the way to go for the pediatrician. At St. Francis Hospital, we have our obstetrics and gynecology clinics, which run from Monday to Saturday of the week. from 9 a.m. to 3 p.m.
Our aim at St. Francis Community Hospital is just to make you in maternity feel like a home away from home, a small B&B.
We'll still be coming here with my baby because I love their services. I highly recommend it to the rest of the mothers who are expectant and even those who are not mothers. Karibuni sana.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Welcome back, dear viewer, to our Health Corner show right here on Capuchin TV with me, Maureen Kimani. And in case you are joining us right now, our conversation today is about day case and surgical care. And joining me in the studio, we have Dr. Kim Mangura from St. Francis Community Hospital. And he has been able to shed more light about day case surgeries, and now we continue with our conversation. And in case you have any questions or feedback you'd love to share with us, or your experience at St. Francis Community Hospital in Kasarani, please do reach out to us on 0717 44 866, or you can use the SMS number that is 21760. And of course, we have the hospital numbers running below. You can also reach out to them for more inquiries. But now let's continue with the conversation, and welcome back, Dr. Kim, for our second part.
Thank you very much.
Because it's been a very informative session for the first part, learning more about day case and surgical care, especially the way you've been able to elaborate and, to speak to the viewers. Thank you very much for that.
I'm glad.
Well, let's continue with the conversation, and please do tell us, because as we take a look wherever we are as a country, in our world, social media, technology has really evolved. How is this technology having an effect to these day case surgeries, making sure that there is efficiency in the hospitals to ensure that the surgeries are well, taken care of?
Okay, well, we have to start, first of all, from the point of the patients knowing it's available. And that's why we have shows like this. So this information going out there, obviously, over YouTube, social media, and so on, that's the first part, patients knowing about it. The second is the patients obviously coming to see us, getting to know who we are. That information is also available online about St. Francis Community Hospital. So the more they know about us, I believe the more they can trust their care to our hands. Now, technology in the side of the hospital. We are basically a paperless hospital. In fact, the only thing, you only sign a few documents when you come in, but the rest of our data is actually kept on our servers. So even the scheduling of your surgery and so on, whenever we book it, the doctor in his computer in his clinic can actually send that booking straight to theater. So they are ready and prepared for that day. well in advance. Yeah, so now there's the technology also from the side of, from the medical side. Now, daycare surgery has allowed us to use new frontiers in terms of how we approach medical care. So earlier I did talk about things like regional anesthesia, where we can actually just block off the sensation to a part of your body and allow you to be awake during your surgery, and thus you don't have to wake up post-surgery. You're fully awake. In fact, for some of our cases, literally as soon as we are done, you can get on your feet and walk away, depending on what we've done. So because of those advancements in regional anesthesia, they've really allowed us to access that ability to care for patients and allow them to exit the hospital as quickly as possible. Now, the other, on the side of the surgeon, because that's the anesthesiologist mainly, although many of us surgeons do also do a bit of that. On the surgeon side, we do attempt to do as much minimally invasive surgery as possible, so as tiny scars as possible and in the most hidden place as possible. So that also sort of allows us to reduce the recovery time for the patient. So you find someone may have had a very big surgery, but very tiny scar. So for example, I can choose to remove an appendix as a day case, and we do that laparoscopically. So you'll have 3 tiny scars just about 2 centimeters each. So, I mean, you wake up and you'll barely be feeling anything. And you wake up and you go home, right on your feet. So that's the technology of minimally invasive surgery. At least we have it at St. Francis Community Hospital, has really allowed us to enhance the recovery of our patients after surgery and allow them to go home faster.
Okay.
Yeah.
And let's talk about maybe the new advancement that you have at Kasarani Hospital, because I understand last year as Capuchin TV, we were very happy and delighted to be part of this milestone that you did last year by opening and blessing the new ICU and HDU unit. And congratulations for that. Do you have any new advancement as far as our conversation today is concerned?
Well, as far as the daycare surgeries, a lot of those services had been available from before, from the regional anesthesia to the availability of minimally invasive care, although I would say not as exploited as we want to make it now. So we're really trying to drive that conversation forward, that these services are available, and as many people as would like to access them should really come and access them. As for the hospital itself, we are still growing. Level 5 is not the highest level, and our aim is always to be the premier source of healthcare in this, actually in the region, not just in the country. So we're in the process of actually trying to open a newborn ICU, a newborn, what we call a NICU. Okay, this is basically to deal with critical care of newborns. So yeah, that will be one of the very few centers in the country offering that.
Wow.
I think there may be about 2 or 3 others. Yeah, so we want to be one of the first ones also in that space. So that's really something we're looking forward to starting off.
Okay,
Yeah.
all right. And, you know, as the hospital, I understand being here at Capuchin TV is by making sure that you spread this information and educate the viewers and patients out there about daycare surgeries and services that you offer as St. Francis Kasarani Hospital. Do you have any other outreaches program to ensure that viewers and patients and people in the country know what some of the services that Kasarani Hospital offers?
Yes, we do actually have an entire outreach group that deals with reaching out to the community through various means. And through that, we've developed many programs that we run throughout the year. So we have some smaller ones. So we have basically very many outreach camps, especially in the church communities. Those run throughout the year. Almost every 2 weeks, we're in one community or another. But spread out throughout the year, we have what we call the major events. So our next major event coming up is our Mother Baby Day. It's a very special day for us because this is a day not necessarily for medicine only, but it's really a community day. So we have delivered so many children over the years. We want those mothers to come back to us and show us these wonderful children they've been raising, who are born especially at St. Francis. But everyone in the community obviously is welcome. That will be on the 1st of March, I believe it's a Saturday. So that will be our first really major event. this year. So we're really looking forward to that. So we're asking for anyone who really wants to come join with us, learn more information. Of course, a lot of the staff will be there. So yes, there'll be some medical information, but there'll also be room for a bit of fun that day. So just to come and commune with us. Following that, the next major events we have, there's an orthopedic camp coming up and an obstetrics and gynecology camp as well. The dates are yet to be confirmed, but they should be later in March and in April. But as soon as we firm up the dates, of course, we shall let you know and invite, obviously, the good people of Capuchin to join us.
Yeah,
yes.
Yeah, as we always do whenever you call us.
Yes.
Okay, let's talk maybe for a viewer who is asking, how long does this process take in terms of, like, when you come to the hospital that you need to have these maybe surgeries? How maybe long can a patient go through this process?
It's sometimes very straightforward, sometimes a bit more demanding. Some cases, especially the daycare cases, because remember I say these tend to be very routine, straightforward cases that take between 1 to 2 hours. For a lot of these patients, the diagnosis is usually quite simple. The planning is quite simple. So I'll give you an easy example. I had a client come to me with a swelling on his scalp, right at the back here. On examination, yes, I diagnosed it as what we call a lipoma, basically a mass of fat cells. He wanted it removed. Now, for his insurance, we needed to do some imaging, just so that they were sure that that's what it is. We sent him for an ultrasound. He was back within half an hour. I wrote out the pre-authorization request, sent it off to the insurance. We were in theater the next day. And by evening, back home. So it can be that fast. Depending on, obviously, on your insurance or you're paying cash, it may take longer or shorter, depending on what hurdles your insurance requires you to jump through to actually access the services. If you're paying cash, of course, it's different. We may just do what's absolutely necessary. If a clinical diagnosis is enough, where I don't need to send you to the lab for imaging, we can just go ahead and plan the surgery, and you access the service immediately, sometimes same day. Yes.
Okay.
Yes.
All right. Thank you very much, Dr. And how do you see these daycare surgeries evolving in Kenya's healthcare sectors over the next years and in future?
So I see it becoming a big part of, especially our surgical practice. I can speak for a few other markets, especially the UK. Almost 2/3 of their surgical cases are done as daycare cases. So over 60% of their patients come in the morning and leave by evening. And only 1/3 actually remain in the ward for further care, inpatient. So it has been a slow uptake, but I think we are generally getting there. There's a lot more acceptance from the medical community. That obviously was the first hurdle. And now even patients who are realizing that, yes, I would prefer to recover in my own bed than to lie in a hospital bed away from my family. Yes, and they realize the medication will be the same that they'll get in the hospital and at home. And as long as you're in communication with your caregivers, I don't think there should be a problem, which is why we keep ourselves quite available to always be, our phones never go off. Yes, so we are usually quite reachable, but so that we sleep well, we always make sure the patient is also sleeping well. Yes.
All right, and are there any myths and misconceptions surrounding these daycare surgeries that patients and people need to understand and to have information about it?
I think the biggest misconception is that someone is not eligible. Okay, so you may think that you may require days in hospital, but it's important to talk to your doctor. And he may actually inform you that, yes, we can actually plan this so that we can take care of you that same day and make sure you get home. So the biggest misconception is people thinking, oh, if I have surgery, I have to take days and days off work because I'll be in hospital for a week. And the doctor might actually tell you, no, you'll only be in hospital for 1 day, maybe take another 2 days off work and you're back to your desk. So I think that's really where we need to open people's eyes and get them knowing that really this is an option for a large majority of them. Yeah.
Okay, thank you very much, Dr. And before maybe we start winding up on our conversation today, I'd love to give some big shout out to the people who are following us. We have Fifi Emush, who's saying I'm following the conversation. We have Ajib Korir from Outreach, Chip Tuyet, Nandi North, following the conversation. Thank you very much, Chip Korir. We have James in Kisumu, Kongole, kwa St. Francis Kasarani Hospital, for the good work you're doing.
Thank you.
Congratulations again. And I'm George from Mombasa, following the conversation as well. Thank you very much, George. We have another one. I'm Catechist Alfred A. Kavihiza, following from St. John the Baptist Mtoni, St. Matthias Mulumba Parish, Matunda, Catholic Diocese of Kakamega, all the way. Wow.
It's quite a wide reach.
I think you should have do you have a branch at Kakamega?
I don't think so, not yet.
Because I can see you have maybe people following you.
Oh, but
Kakamega.
I know the hospital has quite a big following. When we did a cleft lip and palate camp last year. And the reach was all the way from West Pokot down to the coast and even till Moyale. So we had the reach of the hospital, I know, to the community is quite large. Yeah.
Okay, all right. Thank you very much, Dr. for that informative and for shedding more light about these daycare surgeries.
It was my pleasure.
And, it has been a very, enjoyable moment learning and sharing this information to our viewers. Anyone you'd love to say to the patients who are going through these, maybe the healing process, or not only for the surgeries or any other? As being a doctor, you have experience in so many ways. You can be able to share with the viewers.
Well, I think it's really about the relationship between patients and their doctor. I think we need to still develop more trust. Whatever it is you're feeling, tell your doctor. We are always trying to find a way to make you feel better. So if you feel your pain is not well managed, tell us. If you feel there's something wrong with your wound, tell us. If you feel that you're not ready for surgery, let us know why. Because we do have a problem sometimes. You tell a patient, yes, you need surgery. They vanish on you and come back months later when things are not as good. So we would prefer if you just sit and have a conversation with us. Just tell us what your concerns are. Those concerns are also our concerns. Because if the patient is not satisfied, if they're not feeling that they're getting the best care possible, the recovery is not going to be as good as it could be. So really, it's that conversation we need to keep going. So we just need to keep building that doctor-patient trust and that relationship. Yeah.
Trust is key.
Trust is key.
Because even for there's a myth that people say that women feel comfortable being treated by a male doctor, and it depends on how you...
individual preferences.
Yeah, exactly. And before we wind up, I think it's a very interesting, if we didn't touch on this bit, on the diet part of it.
Yes.
Do you have any advice for that?
Yes. So there's only one advice usually we give, particularly before surgery, and that's starve from the night before. So eat dinner and don't eat and come to the hospital. However, there is a misconception about the diet after. Many people, for some reason, think that you need to only eat very light foods. So a patient will come to me a week after surgery and tell me I've been on juice and uji only. We don't encourage that. Unless explicitly told by your doctor, you need to be on a regular diet, because the proteins in your regular diet are actually what help you heal. So the idea of staying on very light things till you come back to the hospital and are told to fully eat is usually not true. And if you're ever in doubt, just ask. You will be told if there are any dietary restrictions, and if there are, you'll be informed. If not, you'll be told, please just go back to a normal diet. Before surgery, when we're planning, sometimes we do ask patients to lose a bit of weight, because that can be a concern for some surgeries. And we have a nutritionist on board who gives that advice, and we can monitor your progress, and as soon as you're ready, we schedule the surgery as well. Yeah.
What do you mean? Weight has that effect on the surgery part of it?
Yes. So, for example,
what are we talking about here?
Well, it's only in the very extremes. So, especially if you're something that's not really emergent, it can wait a bit. A certain loss of weight may be a beneficial outcome to the patient, and actually may make the recovery much faster. So there are times we call it prehabilitation. So rehabilitation before surgery. So we sometimes do that for a few weeks, and then we say, okay, fine, now we believe you're fit, and you follow the advice, and we think you'll follow it even after surgery. And then we proceed from there.
Okay.
Yeah.
Wow. I don't know what should I say after that, but it's been a very fantastic session here on our Health Corner show at Capuchin TV, and especially because of you, Dr. Kim, for helping us to understand and to learn about on how daycare and surgical care is improving our healthcare sectors. Thank you very much. And of course, you were able to mention on the upcoming event that is on 1st of March this year, 2025, Mother and Baby Fair.
Yes.
So you can also take note on your calendars so that you don't miss these services that St. Francis Kasarani Hospital is offering. And just to mention and to maybe put a weight on how you can be able to reach out to the hospital, you can call 0741 689 983, or you can use the number 0795 431 113. Well, Dr. Ray, because I've come to the end of our show today, please, what could be your parting shot that you'd love to leave the viewers with, or maybe you have anything else you'd love to add on how the viewers and the patients can be able to reach out the hospital, and what information should the viewers know about St. Francis Kasarani Hospital?
Well, about the hospital itself, I'd like them to know that St. Francis Community Hospital is a long-standing pillar of the community. We have been growing all the way from a small nursing desk to now a level 5 facility. Really, we offer the complete range of services that most people require. I would say probably about 99%. Our contacts, your viewers have been given. We encourage you to reach out. Do not think that it is beyond us to help you. Wherever you are in this country, we will find a way to try and assist and get you the care you need. So that's I think what's really important, that reaching out of us to them and them to us.
All right.
Yes.
Thank you so much. It's been a pleasure hosting you, and of course we are very grateful to St. Francis Community Hospital Kasarani for sending you here to come and share that information to the viewers and to our people that we love. And thank you very much to all of those ones who are following our conversation here on our Health Corner show. Thank you, and mine is to say that you stay informed, stay healthy, and keep watching Health Corner for more on your well-being. And allow me to appreciate all the people who have been behind on our scene, starting with Charles Marbaton. We have Peter Mwangi, Kelvin Zisa, we have Susan Bulemi, and not forgetting Cosmas Omondi from St. Francis Community Hospital Kasarani for making this a success to, for doctor to come here and to share all that information to the viewers. Thank you very much. And we appreciate you for making time and for sharing that beautiful information there.
Thank you again.
Thank you very much. We love you so much, and make sure that, as we said, that Capuchin TV, we are very grateful, and we ensure that we get concerned on your well-being, and that's why we bring you this conversation, Health Matters, to ensure that you stay healthy. As we say, your health is your wealth. So watch yourself. Bye-bye. See you next time.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Every child is unique, and so is their journey to health and well-being. At St. Francis Community Hospital Kasarani, our pediatric department is dedicated to guiding that journey with expert care, compassion, and commitment to excellence. From the very first breath, our specialized neonatal services ensures your baby receives the best possible start. Our state-of-the-art neonatal intensive care unit is equipped to handle even the most delicate case, ensuring the smallest patients get the strongest support. As your child grows, regular health checkups are crucial. Our pediatricians provide comprehensive assessment, development screening, and immunization, supporting health growth every step of the way. Health is more than just prevention. Our team of specialist pediatricians provide a range of acute and chronic conditions from asthma and diabetes to rare genetic disorders with advanced diagnostic and personalized treatment plans. We also offer comprehensive rehabilitation services, including physical, occupational, and speech therapy to help children reach their full potential, overcoming challenges with strength and resilience. Our hospital is open 24 hours a week. Visit us today for specialist pediatric care.
Congratulations!
I'm Dr. Clovis Ibomana Akili, the resident gynecologist at St. Francis Community Hospital. I say welcome all pregnant mothers where we are journeying with you from the conception all the way to the delivery of the baby, and even after the delivery we give you the way to go for the pediatrician. At St. Francis Hospital we have our obstetrics and gynecology clinics which run from Monday to Saturday of the week from 9 a.m. to 3 p.m.
Our aim at St. Francis Community Hospital is just to make you in maternity feel like a home away from home, a small B&B.
We'll still be coming here with my baby because I love their services. I highly recommend it to the rest of the mothers who are expectant and even those who are not mothers. Karibuni sana.
Prayer break.
Prayer break
Prayer break.
on Capuchin TV.
Prayer for Christian unity.